I worked in the highest ranks of our government, in the political ranks, with the Prime Minister and the ministers. At the time, I was a special assistant to the president of the Treasury Board, and because my background is economics, numbers, that sort of thing, so that was really, you know, my gig. So I did that. I did that job for many years, and then fast forward, I then had a little girl. I still have the little girl. It's kind of a silly way to put it, but I was pregnant again. She was the 5th child. I have 5 kids. And she was born with a disability, and it was that life experience that really changed my life in a very, very big way. So what ended up happening was, unbeknownst to me, I discovered an opportunity because of the experience and expertise that I had, because of the work that I did. I came into the knowledge of discovering an opportunity to help people with disabilities, because there's always been and still is a huge gap. And the gap is when someone falls ill, or they're born with a condition, but mainly if they fall ill. It could be an acquired illness, cancer, MS, Parkinson's, or it could be a sudden trauma that it affects them. It could be an accident, brain injury, as it is now really the topic here for our webinar. People in that category that come into that scenario are not aware of what their rights are when it comes to their financial well-being, because there's never been anyone really to provide that resource and service. So here I come along. I am impacted by disability because I have a baby with a disability. My daughter was born with spina bifida. And I had all this knowledge and experience from the government. And then I saw what was going on in the world there, the world of disability, as we call it, because that was now my new reality. I then, of course, as I mentioned, came across this opportunity. So what I did was I created a company, I incorporated, and it's been 17 years now that I've been helping people all across Canada from all walks of life get benefits and credits that they should be entitled, and educating people on these regards, and fighting for those mainly who have been denied. That is a big part of our advocacy, is fighting or advocating, if you will, for those who have been denied. And that's kind of a little bit of a synopsis, so you'll know where I'm coming from. And then I guess what I'm going to do now is I'll move into the different programs that are available for people with disabilities. Now, besides the provincial government, they're a separate entity in terms of what they provide, like home care, caregiver credits, whatever. There's the federal government. They too have benefits and credit programs for people with disabilities. And I have to make that distinction because it's a very confusing world. And every program has a different interpretation of disability. So what is disability for EIA, the province, the social assistance? That definition is different for the Canada Pension Plan disability for the federal department, for the federal government. So there's lots of information that people get confused, and understandably. But again, because I come from that world, I know how to articulate and I know how that whole thing works. So what we're going to do is I'm going to talk about the 2 main programs that are federal of disability, that later on you're welcome to ask questions, discuss anything perhaps you want to bring out, so you know we can discuss and do a Q&A. Then we can move on into that area. And please stop me if you have any questions, or if you don't really quite understand what's going on, and I'd be more than happy to slow down or stop and assist you in understanding. So the 2 programs I think that would be real paramount here to really understand is the Canada Pension Plan Disability and the disability tax credit. They're both federal. The disability tax credit is administered by the Canada Revenue Agency, CRA. The Canada Pension Plan Disability is administered by Service Canada. They both have different definitions of disability, which means if you are eligible for one, let's say tax credit, doesn't mean you are eligible for Canada Pension Plan Disability. However, with my expertise, depending on what impairment you may have, I know how to marry those worlds, but that's a different story. The Canada Pension Plan Disability holds two fundamental truths, and what they are is, if you are eligible for one, let's say tax credit, doesn't mean you are eligible for Canada Pension Plan Disability. However, with my expertise, depending on what impairment you may have, I know how to marry those worlds, but that's a different story. The Canada Pension Plan Disability holds two fundamental truths, and what they are is, if you are eligible for one, let's say tax credit, doesn't mean you are eligible for Canada Pension Plan Disability. However, with my expertise, depending on what impairment you may have, I know how to marry those roles, but that's a different story. The Canada Pension Plan Disability holds two fundamental truths, and what they are is, if you are eligible for. Hi, I just came back again. I noticed that it was repeating everything I was saying, so I'm not sure what's going on. Gladys, are you here? I'm not too sure what's going on.
Yeah, I believe somebody had their mic on mute.
Oh.
Came in, so I went through and I muted everyone else. So just a reminder for everyone to keep their mics on mute. I have muted them so that we can continue. Otherwise, there is interference. Okay. Thank you. And I'm sorry about that disruption.
That's all right. I thought of maybe stopping.
Came in, so I went through and I muted everyone else. So just a reminder for everyone to keep their.
Okay, so I will continue where I was at. I was starting to talk about the Canada Pension Plan Disability and the Disability Tax Credit. They're two federal government programs administered by two different government departments. The Canada Pension Plan Disability, it has to be argued and established via your doctor that you are not able to work due to your medical condition. There's a very lengthy application process that one would have to go through that will involve your part and also the doctor's part to substantiate your condition, and that all has to be filed to the Service Canada government department. They will do all the adjudication to deem you eligible or not eligible. This program we all contribute to. So all the years that you work, you pay into CPP. That's what this is. And what I've noticed through the years, when people want to retire early, a lot of the times they want to retire a little early because they're not well, their condition isn't chronic, however, they're just not doing well, and they figure, you know what, I'm just going to retire and go on my early pension, and then, you know, life goes on. And in scenarios like that, I would really encourage people to really rethink that, especially if they do have medical conditions that require medication, because if you take early pension, that means by the time you turn 65, your pension that you should be, old age pension that you should be getting from that point on will be greatly reduced because you've taken it out early. And if you can, during that gap, during that time, if you can apply for the Canada Pension Plan Disability, that is encouraged, because if you have an impairment or a condition and you get approved for the Canada Pension Plan Disability, you will still continue to contribute to your pension. So when you turn 65, you should get your maximum amount, whatever that may be. And it goes according to what you've paid into the system as the years go by while you worked. The other program, as I had mentioned, is the disability tax credit. That's a very different program where you can work, you can be, you know, going out and about and you know, doing gainful employment. However, your condition should be such that it affects your daily activity, where it takes you longer. Let's say you got into a bad car accident, you really damaged your shoulder or shoulders, or it could be your back. And yes, you know, you did get rehabilitated, you did go back again to, as best as you can, normal daily activity. However, you have not been the same since prior the accident, and it does take you much longer, you know, to get dressed, to shower, that sort of thing. Those kinds of scenarios are within the disability legislation for the disability tax credit. The disability tax credit is not an income, it's a credit, where when you file your taxes, if you have it, you file your taxes, you get a credit back. And it's based on a formula from the taxes you've paid. It's based on a formula, and you get that credit back every year when you file your taxes. The Canada Pension Plan Disability is an income, and it's taxable. So I think maybe I should maybe stop here and open the floor for some questions, and then we can continue the conversation to elaborate on points, especially pertaining to maybe your situation, or just questions in general that you may be curious about. Would anyone have any questions? Or
I think I have a question, maybe.
Yeah, sure.
At present, I'm receiving revenue from MPI, Manitoba Public Insurance.
Right.
And how does that quite fit into what you're saying exactly there? Because once they wanted me to go on to maybe see about CCP earlier.
They did talk to you about that?
Yeah, but they really haven't paid much attention to me lately, and I'm kind of wondering, because I wouldn't be surprised if they would like me to kind of get off their books.
Yeah, yeah. I understand what you're asking. So number one, the reason why...
No, thank you.
Okay. So the reason why you're on the MPI, Manitoba Private Insurance, is because your impairment was due to a car accident, correct? Okay. So we are covered by insurance, so we go on MPI as a result. Now, what usually happens is people like the MPI or long-term disability, if you have group benefits, this is a separate scenario, but if you have group benefits and you're on LTD, as they call it, or workers' compensation, usually these providers, they will ask the claimant to apply for Canada Pension Plan Disability to offset their costs. So you may still continue to get your MPI, but you won't get as much, and that will be made up by the Canada Pension Plan Disability. So at the end of the day, you'll still get the same amount, but two different amounts coming from the two different entities. So that is something that is very common, and it does happen, and we've helped assisted many people in these kinds of situations. Now, what you got to do is talk to your case manager, see if that's a viable opportunity, and then start exploring if that's viable for you. Because remember, here's the key. If you're just on MPI, or just on workers' comp, or just on your long-term disability, you are now not contributing to your pension like you were back in the day when you were working. So what that will mean is when you become 65, your pension then will not be the full amount that you should have received. It'll be reduced by whatever time frame that you got into the accident, whatever age that is. And then when you turn 65, that could be 3 years, that could be 8 years, that could be 5 years, you know, however. So that's something that's very important to understand, so that moving forward, your financial position is not compromised.
Yeah, I got one thing that I want to say is that whatever province you're in, the rules are different.
Well, it depends.
No, it is true, because my accident was in BC. I was able to get both at the same time. Whereas in Manitoba, you're not allowed to get both. They come off of one or the other.
Well, are you talking MPI or LTD? What program are you talking about?
Talking workman's comp.
Right. Workers' comp has different legislation, and it's very unique case by case. Okay. Workers' comp is a little bit more complicated. But for the rule, generally speaking, CPPD offsets these other providers. And a lot of times they meaning MPI or workers' comp or LTD, your long-term insurance provider, they want you to go on CPP. Now, different provinces are different because workers' comp, LTD is a little bit different, but workers' comp and MPI or equivalent to MPI in other provinces, that's provincial. So each province has different rules, different legislation. That's where you come in terms of saying that's how your program was different, because the province you were in, BC, had a ruling that that program or provider works together with CPPD and both have to come into play. Not all provinces have that jurisdiction. So, like Manitoba. So it's up to the person to figure out if it's viable or not for them in terms of securing their future moving forward.
Yeah, there is a difference between what province you're in.
That's right. That's right. Just like just like the, how do you call it? The provincial social assistance. Those rules are different for every province too.
I got a question then.
Yeah.
Only because I'm going through it as 2 minutes before I got onto this webinar. I'm with Blue Cross. I finally approved my LTD, but they're making me apply for my CPP. If I don't, they have the right to deny me if I don't?
Well, technically yes and no. A lot of our cases, a lot of our claimants are in your position. So what we do is, if you apply for Canada Pension Plan Disability and you get denied, it may happen. Blue Cross, they may turn around and either reduce your benefit, or worst case scenario, I don't think they'll do this, but worst case scenario, and we have seen sometimes, they may cut you off. In cases like that, people have come to see us and we've reinstated them on their LTD, using the Canada Pension Plan Disability Program, getting you on that and using that as a leverage to get you reinstated with LTD. So going back to the main question was, can they cut me off? Technically, yes, they can. Technically, they can.
Okay, well, I filled it out and signed it. I had applied and a whole bunch of garbage happened, and so it took 6 months longer than it was supposed to, but I'm waiting for CPP still, but they've taken into the account of me going over the 90-day. They've accepted my appeal, so I'm just waiting for them now. How long does it, I guess, I don't know if this virus thing is slowing things down, but how long would it take generally on a reappeal, or them looking at it again?
Is it a reconsideration or appeal? Where are you at?
I don't know. I got a brain injury. I can't remember. I'm pretty sure it's. I'd applied for it. They denied it because I made some mistakes. Right. So did my LTD. So I worked with Gladdy, and we got it. I finally got it approved about a month ago.
Okay.
And so my CPP in February, I sent a note to them going, "This is the updated information from my doctors," and they sent it back saying that they would reconsider it without starting, because I was over the 90-day, but they said with my excuse, basically, they will continue it without it. Like they won't slow me down.
Right. So it was a reconsideration that you did, because this reconsideration has a 90-day window.
Yeah,
so
I was at like 94.
Yeah. Oh, yeah. They will be lenient and take you in and consider and adjudicate your case. So in a situation like that, a reconsideration can take anywhere up to 3 to 4 months. Could be sooner. but you're looking at that kind of time frame, especially now with COVID, you know. Yeah, they are a little bit slow. They had to do a lot of modifications, but you're looking at about 3 to 4 months, give or take.
Okay, so being I put it in February, so we're looking next May or June.
Right.
Yeah, because I was about to give them a call actually tomorrow and see what the update was, but I didn't want to, with everything going on, I didn't want to push them either. It's like it happens, it happens.
Yeah.
Okay.
Can I ask you what LTD stands for?
Yes, LTD is the acronym for long-term disability, which means if you work for a company and you got benefits, you know, dental, vision, also in that benefits package, you have long-term disability and short-term disability coverage if you get sick. So LTD stands for long-term disability from an insurance provider through your business or through your company you work for.
And then when they change it to CPP, how do you know that? Because originally I was under workman's compensation because before my brain injury, I had already had PSTD from my work.
So are you on Canada Pension Plan Disability now?
As far as I know, yes.
Okay, so you're fine. You should be fine.
Okay.
Yeah, are you on LTD also, or is it just?
No, I don't. How would I know that?
Well, because through your group benefits plan with your employer, you would have been receiving money from them, but also applied, because there's an application process for that too. Like the other gentleman who was just on, he had to apply for that.
I'm sorry I was late, but at the same time, thank you for your questions, Lynn. But I also tell you this, I am retired, so automatically I think my disability went to CPP.
Yes, yes, I see your point. So if you are 65 or older, yes, if you were on CPP disability, it immediately converts to regular pension. Yes.
Okay, and then after my brain injury, I think I got, okay, I'm gonna tell my first joke today. I got credit for that point.
Okay.
Anyways, the brain injury appreciation.
Okay, I noticed there's a few questions in the chat, and I'll read them and see, and I can answer them that way. Okay. Here's a question. Do you have to be approved for a CPP disability before you can apply for RDSP? No. The RDSP has nothing to do with the CPPD. RDSP means Registered Disability Savings Plan. That program is tied into the tax credit, the disability tax credit. And yes, for the disability tax credit has to be in place before you can have the RDSP. So that's one question. There's another question. Can you use LTD as leverage to CPP disability instead? No. If you got denied LTD, you can use Canada Pension Plan Disability, applying for that and getting approved for that. You can use that as leverage to get reinstated for your LTD. But you cannot use LTD to justify or get approved for CPP. I'll tell you why. The legislation for the Canada Pension Plan Disability is much more stricter, much more harder to prove than the legislation for the long-term disability or LTD. So if you got approved for the Canada Pension Plan Disability, which is much harder to get approved for, and the disability is severe and prolonged, so that should be a stepping stone for the LTD, because the LTD legislation for disability is not as stringent or difficult, as we say, to prove as the Canada Pension Plan. So it's the reverse. There's another question here. How do you go about the application if the doctor is not cooperating with you for the application? That's a very big problem. That's a very good question, and it is a big problem. If the doctor, for whatever reason, does not support you, it's because the doctor doesn't understand how your disability, how that translates to the program, because usually they don't understand the program and what constitutes eligibility. So that's a big problem. So in a scenario like that, which we have encountered with our clients, is if they have other doctors that they can speak to that have relatively an understanding of their medical history, that is encouraged, and get another doctor's opinion. You can't force a doctor to fill out forms. I mean, you can't do that. I mean, it's not ethical and it's not right. But it is unfortunate. And we have seen that where the doctor, for various reasons, is not supportive to fill out forms for their patient. There's another question here. Do you get cut off from CPP disability or get clawed back? No, that doesn't happen with Canada Pension Plan Disability. No, if you are approved for that, that's an income. You are approved, and believe me, they go through a lot of tests to make sure that you're eligible. So when they approve you, you're approved. I think that question may be more applicable to the disability tax credit. I believe, I'm assuming, I don't know, but I think that question would be more tailored for the disability tax credit. So let me read the next question that we have here. It says, if you have qualified for the disability tax credit, do you need to reapply for this benefit each year when doing your income taxes? No, you don't. When you get approved for the disability tax credit, you will get a letter telling you you're approved by the government. That letter there will tell you either you're approved forever or when you have to reapply. So they don't have you reapplying every year. It doesn't work that way. It's either you're approved forever or you're approved for about 4 or 5 years, minimum, and then reapply. There's none of this applying every year. That doesn't happen with the tax credit. I'm just looking to see if there's any other questions. Okay, that's all the questions I have here. Does anybody have any more questions or anything else that they would like me to talk about?
I have a question.
Yeah.
I just think it's really important for people who are on the MPI system to understand that MPI is a non-taxable benefit, and if they're forced to apply for CPP, then there's tax implications that come into play with that, so that they need to work with their case manager very quickly to make sure that they understand the financial implications of that.
Well, and that's a very good point you raise, because besides that point, there's another variable that if you're on MPI or workers' comp, until you retire, whenever that happened, that you started collecting workers' comp or MPI, you're not contributing to your pension. That's another factor. If you get onto the Canada Pension Plan Disability, you are contributing.
Correct.
Although it is taxable, the taxable is small. It's not like you're going to be taxed and they're going to take your house and your kidneys and bone marrow. They're not going to do that. It is a taxable income. However, the offset to that, which is worthy of considering, is that you are contributing every month to your pension. So when you apply and then convert to your pension, your regular pension, you will have most of it and not have a lot of it, you know, reduced as a result.
So, I do have one more question, which is just with regards to what you've said. So in terms of a pediatric brain injury, you wouldn't qualify for CPP because there's no, if you're not working, you haven't put in anything into the system, correct?
Correct. Canada Pension Plan Disability just like the disability tax credit. You see the value in it if you contributed to the system. That's why, that's a very good point too that people have to understand. That's why the provinces, every province, have what we call the social assistance for those people who, you know, for this kind of a reason have not contributed, so they can't be eligible. Then they have a different support mechanism to, you know, to help them live. That's a very good point. I want to illustrate something, and it goes on what you're mentioning here. In all the years that I've worked with the disabled community and with the corporations, because we work with the insurance companies, they're our clients. What I see all the time is people in these predicaments, you know, they're disabled now, and you know, they got to look at all these different things. There's not much support and financial advice for people in that situation. You know, like I've so many times I've heard people say, I was 62 years old or 61. I was not well. I was very sick. I couldn't work anymore. So I took an early pension, only to find out when they're 65, their pension now is not $1,300 or $1,100. It's $600, and they're panicking like, oh my God. And the sad part was they never had anyone tell them, look, obviously you're 61, you're not feeling well. Maybe you should consider thinking and exploring Canada Pension Plan Disability. Go talk to your doctor. See what he says about that, because you need the doctor's support, obviously. And then that could start something else and veer them off into a better financial position. And that's an unfortunate thing. And this point, I'm sorry, what is your name that you just asked the question?
Oh, Barbie.
Barbie, that is a very, very, very good point that you brought up. It's not just about applying for these programs. That's one thing. It's understanding where you fit in and your circumstance fits in for that picture, which is life altering and can be.
Absolutely. So that's the other thing, is that we're in a situation that we're dealing with a pediatric catastrophic brain injury. Does that, with MPI, my understanding is that's like a lifetime.
Yes.
benefit.
Was that through a car accident?
Yes.
A little person got injured?
Yes.
Yes. For life, they will be on MPI. Yes.
Okay.
Yeah.
Thank you for clarifying.
Yes, they will. We've had claimants in that situation too. Yeah,
Okay.
where we help them navigate, financially speaking, these what can be complex waters for the family.
Yes. Yes.
Yeah.
Thank you so much.
Yeah. So one thing I want to really make clear here is it's not just about filling out forms, people. Okay, it's not about that. It's about understanding your scenario, what programs are valid for you, and also your future, what your future looks like, your family situation. Are there caregivers? It's a very complex picture. It's not about filling out forms and okay, and my doctor will fill it out. If that were the case, we wouldn't have these organizations like Manitoba Brain Injury to help and facilitate and be a resource. You know what I mean? And yeah, it's a really uncharted territories for a lot of people. Very, very uncharted and misunderstood too. A lot of financial advisors are not well versed in this. A lot of them, I would say 97%, maybe 98, if not close to 100, are not well versed in these matters. And it's unfortunate. But anyways, when I came into business and created a business in this area, we made sure to cover all these areas for claimants when they come to see us. So we have, just to give you a little bit of understanding, we have retail, which would be someone off the street coming to see us for help, but we also have corporate clients, and our corporate clients are the insurance providers like Blue Cross, RBC, because they're in the life insurance business too, Great West Life, Wawanesa, and so forth.
Hello, can you hear me?
Yes.
Yeah, my name is Laura. I'm Melissa's mother. I just have a comment. and maybe you can shed some light a little bit further on in what I want to speak about. I have to agree, yes, it's unfortunate there's not enough, I guess the word is knowledgeable people, or not enough people doing the advocacy that's needed, so that there's so many people that are not well informed. And we had to, it's been a while now, but Melissa is receiving Canada Pension Disability.
Mm-hmm.
And she also has the RDSP. But getting on that was very difficult. And yes, the doctors that tended to her during the time of her accident and when she was hospitalized, when we went back to them asking for a medical report or to some assistance and the documentation we needed, they just totally refused. They just said no. Well, they didn't say no. They said, you have to go to so-and-so, go see the other doctor or work with her. I can't. The doctor we did get was totally, was not even involved in any of her treatment at the time, but became her doctor. And we had to jump hoops actually to get the help of this doctor to complete Melissa's medical report. Otherwise it wouldn't have happened. And I'm fortunate that we had somebody in the system who could help us, but otherwise it's really sad that, you know, whoever is going to, how are you going to know, how are you going to happen to find somebody in the system who's going to help you? I won't say how, but we had to do it that way. But it's really, I feel badly for people who don't have the means, the resources, or the support to do that. So I don't know if and when it can happen, or somebody can set up kind of an advocacy office, or there really needs to be somebody.
I'll explain that whole world that you are talking about. Here's the problem, Laura. Nonprofit organizations or an advocacy organizations, they cannot afford someone with the knowledge and expertise like me and my staff. Let's just be honest. They don't. They can't afford that. Okay? Now, I'm a for-profit. There's no way on earth the government would ever fund me for me to fight for you and everybody else who's in this predicament. They would never fund me. They would never do that. It's a weird world that we live in, but that's the reality. So the problem is there isn't any expertise out there that a nonprofit or an advocacy agency can afford. Do you see what I'm saying? It's a sad world. That's the problem. Now, how I made my services accessible, how I made it accessible was where all the work we do is on a contingency. In other words, we'll do all this work for you, and if we're successful, whatever you get back pay, we will get a part of it, just to cover our admin, cover our expenses and so forth. Everything moving forward is yours. But anything short of that, the government would never fund me, never. But we deal with very complex situations. We do tribunal hearings with the Canada Pension Plan Disability, and we do appeals. So we deal with very, very difficult, complex situations. Okay, again, that's a level of expertise that an advocacy agency, the government would never fund that. I'll give you an example of what I mean by that. Here's me, you know, background in economics. I'm former ministerial staff. I got staff members who are in the medical community. They are former tribunal judges. I mean, they have a very high-end skill set that is very difficult for a nonprofit, if you will, or an advocacy agency to be able to pay people like that. And number two, they would never, they meaning the government, would never fund an agency, if you will, that's going to be battling them and going against them. It's almost
exactly. Yeah, that's the same goes for any other groups. I would think advocacy groups. Mm-hmm. Yeah, bite the hand that feeds you, sort of thing is.
That's right. So that's why you will never find. I shouldn't say never. That's why it's very, very difficult to find a social worker or someone whoever who works within the nonprofit world, you know, because they do great things. They do great things. They support and they're a resource. But it's very difficult to find people with like very high-end, high-level knowledge. It's not about filling out forms. You know, it's understanding and also the medical community. What's been real prevalent, and you experienced this from what you're explaining, the medical community is part of the problem, you know. It's not just so much battling, it's not so much battling the government or figuring that out. It's the medical community. It's like, are you kidding me? You know, like who wants to be on disability? Let's just be honest. You know, people have no choice to go onto these programs because of their circumstances. Who knows? I may have to, you know, access that because something may happen to me. I may get hit by a bus too. But I find in our experience that the doctors, for various reasons, I have my assumptions, you know, a lot of them is they don't understand the legislation of the disability program, and they think the patient isn't disabled enough, and they won't do it.
But
So,
anyway, on that notice, yeah, on that notice, I was going to say all that process that we went through, excuse me, was all for naught because Melissa was not eligible for CPP disability. She continues to stay on MPI. That's what. But apparently, we had to go through all of that just so MPI could see the outcome. That no, she's not eligible. No, she can't. No, they couldn't offset their costs.
Right.
CPP.
Right.
That's what happened there.
Now, what is she doing for her retirement in terms of securing a little pot so when she does reach her age of retirement, she will still have money enough that, you know, she can somehow sustain herself?
Well, again, like, you know, we're fortunate somewhat, but it was not for, none of this happened like with the flick of our fingers. It didn't, we did there too. We're fortunate enough to have a good financial advisor,
right.
And that she's got that stuff taken care of.
That's great. That's awesome. Yeah. Not everybody is in that situation, unfortunately, where they don't have the financial advice, the advisors to help them, you know, set themselves up so when they're older, they'll be okay, you know. Not everyone's in that, you know, good situation, unfortunately.
Yeah. Well, yeah, it took some time to get there, so it's not that we haven't gone through the anguish and some anxieties as well, so, and challenges, but yeah, thank you.
Oh, you're very welcome. Thank you for sharing. Thank you. I'm going to see if there's any more questions here. Let me see.
I want to also remind us about human rights, because it was human rights we went through regarding issues with handy transit. So why can't they deal with some of these? And I want to ask the question, what about workers' compensation? And there's lots of arguments there too.
I don't understand the question. I'm sorry. Can you repeat?
What about workers' compensation?
Yes.
Okay, and the other issue with you guys were talking about is what about human rights for an advocacy group?
So human rights, what about human rights and advocacy group, you mean?
Yes, you were saying that the advocacy groups, etc. The nonprofits can go through human rights, is what I'm saying. It's one of the places that will work with the brain injured and other things.
Right.
But it's workman's compensation. A lot of our people have a whole lot of arguments with workers.
Right. Yeah.
And who is fighting them? And I do know of an office that opened up just this past year that are, well, no, I guess it was 2 years ago now, that are fighting workers' compensation issues. But at the same time, people with disabilities and things happen shouldn't have to fight so hard, and all of the paperwork, etc., is really difficult. I don't know what I would do if I was brain injury.
Yes, yes. That's what you're bringing up and talking about is a separate matter. Fighting for disabled rights or injustices. That does happen. Yes, that does happen.
So how do you come in?
We don't deal with that. That's separate. That's a whole separate matter. It's a separate issue.
So you only deal with what issues do you, because I missed the beginning of this, I'm sorry.
Yes.
So will you tell me what issues you are dealing with?
Yes, yes. We are a company that help people who have a disability access federal government disability programs. But we deal with them at high levels, meaning people who are denied, people who have very complicated cases. We do tribunals, we do appeals, and we work for people in that regard. We also connect them within the financial industry to get them set for future, for example, retirement and so forth. So we deal with disability programs.
Okay, just people, on the federal level though.
Yes, mainly federal, yes, yes. We do the federal only. The province, all they have is the MPI if you had a motor vehicle accident. There's workers' comp if you had an injury at work, or Manitoba social assistance. That's the provincial, you know, programs or providers to help people with disabilities. We don't deal with that. We deal with the federal disability program, which is the Canada Pension Plan Disability and the Disability Tax Credit. We also are connected with advisors to deal with the RDSP, which is the Registered Disability Savings Plan.
How do you get involved with that?
Well, what
especially when you're already on a retirement CPP and old age.
Well, are you talking about the Registered Disability Savings Plan?
Yeah, I didn't know about it before now.
Okay, the Registered Disability Savings Plan is for people who are 60 years of age and younger. If they have the disability tax credit, they can open up a plan. And it's geared to save money for your retirement. Yeah, you're welcome. Let me see if there's any more questions here. No, I don't have any questions here at the moment. Is there anything that anyone would like to discuss or are curious about, or anything pertaining to their situation perhaps? Well, I guess what I'll talk a little bit about is about my daughter. When I started this webinar, I explained how this whole direction of my life that I took was a result of my little girl. I gave birth to a disabled little girl. She's a big girl now, she's 17, and she was born with spina bifida. And I love talking about her because at the end of the day, the message I'd like to give to people is that although sometimes life, you know, brings setbacks, there's always a silver lining at the end. So how that applies to me was how I made a detour with my career. I left the parliament, I left the minister's office, you know, created an advocacy organization that's nationwide, but also talking about my daughter. My daughter is a para-Olympian and won silver medal for the Canada Games back in 2017. So, you know, that really made me a proud parent, obviously. Any parent, I think, would, but also explains and illustrates, you know, that life is what you make it, you know, and we all have our setbacks. Trust me, I've had my share, you know, and if anything that I'd like to, you know, convey to everybody is that there's always a silver lining at the end. Just keep going, keep moving, and good things will always somehow come up. They do. Just keep trying, never give up.